Hi guys, welcome to another episode of Conversation with Dr. Allen. As we're here now trying to prepare for what is designated as a COVID winter. This year we believe that it's going to be one of the worst winters ever. Let me show you what we put in place to make sure you're safe. Instead of the tents as we had last year, for those individuals who's been following the program, I've actually organized a COVID treatment room specifically designed for those individuals who are truly ill. The COVID treatment room is adjacent to our crash cart, allowing us to grab whatever we need, walk into the COVID treatment area. The COVID room will be accessible, as you can see the guys are actually doing construction, right from the crash carts. Whereas we'll be able to enter the COVID room and administer whatever treatments, injections, breathing treatment, or anything needed to help the individuals that's ill. I'm going to show you the other side, and just for my love for you, I gave up my office to make sure that you are safe. Let me show you around the other side. The COVID treatment area is designed to replace the tent which we used early April and May during the COVID season at its early stage. The purpose of the COVID treatment area allows individuals to come along the side, respect for any individual who may have a handicap to enter the room. To demonstrate the COVID treatment area, we have two areas for possible injection and or need for any staff treatment. Remember, the staff will still have their N95, they still will have their gowns on, using this to reach through for any type of injections that may be needed. We have another separate opening for passing of any equipment that the patient may need and or testing for the COVID virus. Here's a quick view of the COVID room completed. This side represents where the staff will be standing. This other side represents where the patient will be sitting. The parking lot now is more efficient. The parking lot now has the capacity for 47 people. As you can see, there are several patients here now waiting to be seen. This would allow patients to actually sit in their car when they come to us, and then we could call them in as needed. Those individuals who are sick will be then brought around to the COVID area where we are able to treat them, isolating them from other sick individuals. Let me show you what we're doing inside. You put them. Your son?
My son.
Yes,
Yeah.
As we come inside of the clinic, you can see that the patients were spaced out 6 feet and more. We've installed a glass protection, therefore allowing nothing more than communication with the patient from the outside with staff on the inside. Each room will have its own Lysol cleaning product to clean the room, along with a hand sanitizer in the room for patient, physician, and staff to make sure that the patient and I and you can avoid this virus during this time. As we walk down the hallway, each room will be structured for an acute emergency involving a crashing patient who can't breathe or need an IV service. As you can see, the rooms are currently being painted and structured for the event as I just spoke of. I've specially organized 2 separate restrooms, of which we'll be changing for patient restroom only, again with all the essentials that the patient needs, and I will be having a second restroom here which is designed for staff. The restroom will have a keypad operated only for the staff to go in, trying to prevent staff from infecting patients or patients from infecting staff. Now, the exit and entry for paramedics for any acute illness will come from this direction. As you know, The president just tested positive for the coronavirus. As you know, healthcare professionals are 3 to 4 times greater risk of catching this illness. As you know, healthcare professionals with any underlying disease, such as high blood pressure or diabetes, are also a 2 times greater risk of dying from this illness. Anyone out here doing this COVID winter, which is probably going to be the worst winter ever since I've been practicing medicine, is out here because we care about you. We're sacrificing ourselves to make sure you're okay. We're preparing and setting up to make sure you're okay. Remember, we're here for you and we care about you. Thanks for watching Conversations with Dr. Allen. Hi, how you doing there?
Hi, I'm the grandmother of a 3-year-old who we had to bring to Dr. Allen. He had tested positive for the coronavirus. He got better. He didn't get too sick, but we did have to bring him here. Thank God that we were able to come here and he was able to get tested. And then a couple of weeks later, the 2-year-old came back positive, and they both are okay and they both are good. But thank God, I was able to see the good things that's happening over here, the things that he's building, and it's just great. So now here I am back, because this is my second visit, and he's taking care of me now. So thank God for Dr. Allen, and thank God for the building, and I'm just grateful that he's here and rebuilding and doing